we are live. We are live, right? So, just streaming. And I have. I have lunch in a bit, but the timing will just stream. Just in a bit. I'll stream for like 5 minutes, to be honest. Which, any amount of time is good, I feel. So yeah, we were looking at Salit, which just a second. We are looking at apoptosis, which is normal process of cell death. It is individual cell necrosis, and it is not simultaneously localized necrosis of large number of cells. It's very small number of cells which are actually undergoing necrosis. So they are in liver. This is happening, and yeah, this is mostly because of infection by viral hepatitis, and they are large pink, and there is loss of cytoplasmic detail. There is no detail cytoplasmically; they're all just blobs. And without nuclei, the cell nucleus and cell cytoplasm becomes fragmented, and they become what do you say? Without enzymes and as such, look, they're all fragmented, small fragments can be seen. Yeah? Right. And without nuclei, the cell nucleus and cytoplasm become fragmented as without due to enzymes such as caspases, which destroy the cellular components. Yeah. Right. Next we have. This is fetal thymus, and there is involution of thymic lymphocytes by the mechanism of apoptosis. Here also you can see similar cases. It is an orderly process, and it is also normal immune maturation. You can be seen. Okay. And apoptosis is controlled by many genes. One of those is BCL2, and BCL2 which is turned off, and BAX gene which are turned on. Several genes are there which are influencing the apoptosis, and you have to learn about all of them. And there are also caspases, which are enzymes which cause the breakdown of the cells. Okay. Next we have an image showing cell death and necrosis in myocardium. Here there is lot of mess because the cells have died and the tissue is not recognition. This is actually the myocardium, and the many nuclei will become like pycnotic, which is shrunken and dark, and they have karyorrhexis and fragmentation and karyolysis. So three processes in apoptosis. First you have pycnosis, then you have karyorrhexis, and you have karyolysis. So first the nucleus will shrunk, and it will become small, and then it will become fragmented, and then it will become disabled. That is the process of apoptosis. The cytoplasm and cell borders are no longer recognizable. They appear like a dead tombstone. Okay. And in this case, there is loss of blood supply from one of the coronary arteries, which is leading to ischemia and cell death, programmed cell death. Right? Then you have a slide showing actual viable myocardium, in which cells are dying as a result of ischemic injury in the coronary artery occlusion. The nuclei of the myocardial cell is being lost. You can see that there are just fibers. There is no nuclei in this one myocardium, for example, and the cytoplasm is also losing its structure, and there is no cross striations, which is very much seen in heart tissue. And one of the question is, which symptom may accompany the organ ischemia? In this organ, angina. Yeah. Pain, right? Visceral pain, deep visceral pain. Then we have renal infarct, and you can see very clearly this is the infarct. Yeah, and the many cell undergo necrosis at once. They form a definable pattern of necrosis is produced depending on the nature of the injury, the type of organ, and the length of the time. There is an example. This is an example of coagulative necrosis. Yeah, because there is loss of blood supply, and the resulting tissue there is anorexia. wedge-shaped pale area is coagulative necrosis in the cortex of the kidney. Then we move on to histological picture showing anoxic injury here, and there is also left of the cell appears pale and ghost-like. Yeah, it's very pale and ghost-like, and there is hemorrhagic zone in which the cells that are dying or have not quite dead yet. Yeah, they have damaged blood vessel and blood is leaking, and they are all normal renal parenchyma in the far right. But here there is blood in all of these tissue, hemorrhage, and yeah, it's leading to coagulative necrosis. Yeah. Then there is a contrast between normal tissue and the pale infarct. You can see here all is the hemorrhagic area, and this is all pale. Yeah. Area under the capsule is spared because of blood supply from the capsular artery. So in the case of the frontal cortex, there is a capsule. No? Then in the capsular artery, there is blood supply sparing. It illustrates the shape and appearance of ischemic pale infarct as well. Then we have coagulative necrosis seen in spleen. Since coagulative necrosis is usually vascular supply, due to vascular supply blood loss, the infarct occurs in a vascular distribution which is appearing as a wedge shape. Yeah, the base is often on the capsule in case of spleen. Then we have ischemia of large part of the bowel. Yeah, this is seen, it appears red to grey in the infected bowel, and in contrast with the pale pink which is seen here. Here you can see normal bowel, it's all pale pink, here it's very much red. Yeah, and some organs with bowel ischemia, such as bowel ischemia with anastomosis blood supply or liver with a dual blood supply are harder to infarct. Yeah, because there is supply from superior mesenteric artery and inferior mesenteric artery. It is a little bit difficult to find out. This bowel was caught in hernia and mesenteric blood supply was lost due to hernia sac. Right. Actually, I'll take a bit of a I'll be back in 15 minutes. Yeah. Okay, so let's continue. We are talking about different types of abscesses which are seen. So here you can see there is no abscess right over here, and there are a few examples of liquefactive necrosis. There is liquid central in area of tissue injury, which is right here. Yeah, and there is also one in the lower lobe, a little bit smaller. This is a non-abscess. And they are liquefactive necrosis. They may also be coagulative necrosis, but mostly it is liquefactive necrosis. If they have a lot of lipid, such as brain, or when there is abscess with lots of inflammatory cells, that is also a inflammatory cells which release proteolytic enzymes. That is also an example of liquefactive necrosis. Yeah, abscess is an example of liquefactive necrosis. Fine. Here abscess shows this is a small liver abscess, and many neutrophils is there, and it is a localized liquefactive necrosis. Grossly, it is a yellow to tan because it is filled with pus. It is a purulent exudate. Fine. Next we have, this is liquefactive necrosis. Here you can see very little cells are there. Okay. Yeah, in the brain of a patient with stroke, there is focal loss of supply, and this leads to necrosis, and it is loss of neurons and endoglial cells. There is formation of clear space at the center. As it resolves, the liquefactive area becomes a cystic space. As it becomes a cystic space. It will be lined by epithelium, and it becomes clearer. Then we have liquefactive necrosis of brain, which is showing many macrophages, and they are cleaning up the necrotic debris. Yeah. Here this is a gross cerebral infarct. Here. And the upper left margin, it is due to middle cerebral artery. Most of the time, if it is in the middle of the brain, it's due to middle cerebral artery infarction. Okay, removal of the dead tissue leaves behind the cavity. There will be a cavity and it becomes cystic space, as explained. There is a cerebral perforation also, and cerebral perforation, proliferation. Infarct of the brain is organizing and is being resolved. Okay, in this one, it is becoming liquefactive necrosis here. Cystic spaces will be formed as the necrotic tissue is removed. Then we have this is the fat necrosis of the pancreas. Cerebral injury to the pancreas will lead to a release of powerful enzymes which damage the by production of soaps. These are grossly appearing as soft, chalky white areas on the cut section. Yeah. Then microscopically they have this is the fat necrosis of the pancreas. There are some remaining steatocytes at the left which is not necrotic, and the necrotic fat cells are present in the right. They have vague cellular outlines, and most of the peripheral nuclei and cytoplasm have become pink. There is amorphous mass of necrotic material there. Then we have a gross specimen of caseous necrosis in the hilar lymph node. It is seen in TB. Yeah, miliary TB also may be seen, but I don't know. It's not very clearly seen. Caseous necrosis is really a combination of coagulative and defective. It is most characteristic of granulomatous inflammation like sarcoidosis, TB, and as such. And there is image showing extensive caseous necrosis with cheesy tan granuloma in the upper portion of the lung in a patient with TB. Tissue destruction is so extensive that there is areas of cystic spaces and all that. Okay, and is being formed as the necrotic, mainly liquefactive necrosis drain out via bronchi. Liquefactive necrosis will be draining out via the bronchi. Yeah. Next, we have a microscopic image characterized by acellular pink area of necrosis in the upper right, surrounded by granulomatous inflammation. This is a PEB picture. So gangrene or necrosis of many tissue in a body part is, as in this case, this is the gangrene of the toes in a diabetic most probably. Yeah, dry gangrene, mainly coagulative necrosis from the axonic. There is a loss of nerve supply, and then slowly in a frostbite injury there is a loss of blood supply also, and it will become gangrenous and it will fall off. Yeah, this is a dry gangrene. Gangrene in the lower extremity, in this term wet gangrene is more applicable because that is a liquefactive component which is superimposed infection in addition to the coagulative necrosis from loss of blood supply. The patient had diabetes. Diabetes is an example of wet gangrene. You should remember that. Yeah, diabetic foot ulcers patient is a serious complication, and if the ulcer is more patients with ulcer have more than double the risk of death in 5 years than a person without that, because half of these ulcers develop in an infection that is hard to treat because of poor circulation and reduced viability. Tissue viability is very much reduced, and there is poor circulation. Almost 1 in 5 for severe foot infections die because of very much infection and all, which may lead to septicemia and shit. And next we have gangrenous necrosis, which is seen in the tissue of the body part. The inflammation is seen extending beneath the skin of the toe to the soft tissue. This is the skin. You can see there is all this infection. See here? You can see infections all over here. Fat and connective tissue to involve the soft tissue. Fat and connective tissue at the right and bone at the left. Okay, this is a bone actually. My bad. I thought this was skin, but no. You can see this is on arteries. Right, this is both. Because of multiple tissue are non-viable, amputation of such area is very much required. No, wait, my bad. Next, we talk about adiposity, which is basically if it is exceeding the amount of calories which we are consuming, if it is exceeding the expenditure with through basal metabolic rate plus physical activity, then the excess is stored as body fat. An overall estimation of adiposity is done with the BMI. The range is as provided. This is in US. In India, this is 23.5. Yeah, then 23.5 to 28.5, and more than 27.5, 28.5 is very much obesity in India. Right? Degree of adiposity is estimated in other ways. Measurement of total body fat is possible with several ways. So, imaging technique of dual energy X-ray sublimatory, dual DEXA. Yeah, originally developed for measurement of bone mineral density. It is different tissue will absorb this different amount of X-ray. And it can also be helped to find out bone fat and lean tissue, how much is there. And yeah, DEXA tends to overestimate and underestimate body fat in patients with low fat percentage and high percentage, but it's okay. It basically dampens, you can say. Right? There is also bioelectrical impedance analysis, which is also used for estimation of body fat purposes. I don't think it's very much important. Skin fold thickness has been employed in several other places, like pediatric cases and all. And it is also been very simple. Hydrodensitometry involves measuring the body component of having a person immersed in water and the subject's weight in air and weight while immersed in water. This is not being done. There has been research done, but it's not being done, I guess. Yeah. Obesity is not very much the topic of pathology. So, but this is you have. Yeah, cytoplasmic organ damage to interior of you can see malady bodies. Yeah. It is seen. Seen in alcoholism. Yeah, malady bodies is seen in alcoholism, prostate ban bodies, alcoholism, acute alcoholic, chronic alcoholism, chronic hepatitis. Yeah. They are form of intermediate filament between the size of actin and myosin. You can see. Then we have neurofibrillary tangents in neurons of a patient with Alzheimer's disease. Yeah? Cytoskeletal filaments are grouped together in elongated pink tangles. Then we have intercellular accumulation of various material in response to cellular injury. Here it is a steatosis of fatty metamorphosis. Fatty changes in liver. Very much fat globules you can see everywhere. Yeah? In which deranged cell protein metabolism from injury leads to accumulation of lipid in cytoplasm of hepatocyte. So there are large clear adipose lipid droplets that fill the cytoplasm of many hepatocytes. What is the causes of hepatic steatosis? So it can be seen in alcohol consumption, excessive alcohol consumption. It may be seen in lipid metabolism issues. But let's see. Liver injury from metabolic dysfunction associated with steatotic liver disease, MASLE, and the consequence of diabetes mellitus, metabolic syndrome, and obesity. Chronic alcohol use is accompanied by steatosis. Infection also often viral hepatitis may also induce steatosis. Chronic hepatitis typically have a component of steatosis. Yeah. Okay. One thing you have to remember is metabolic associated steatotic liver disease, MASLE. Liver injury in chronic alcoholism leads to fibrosis and regeneration. There is macronodular and micronodular regeneration leading to formation called as cirrhosis. Yeah. Congo red stain, which is used to stain calcium and amylite. It can be seen in cases where there is abdominal breakdown of proteinaceous material. Okay. This is appearing as orange. It can be connected within cells, tissue, brain, a lot of places over there. Kidneys. Yeah. Cellular injuries can lead to accumulation of specific red color globulin substances. These are seen on PAS stain, and this is accumulation of alpha-1 antitrypsin in a patient with congenital defect involving cellular metabolism and release of the substance. So there is some metabolic disease which is leading to alpha-1 antitrypsin being secreted. It appears as a red globulin in PAS stain, periodic acid shift stain. Fine. Inherited diseases of metabolism involving enzymes in degradation pathway. You have a defect such as enzyme leading to accumulation of intermediate filaments. In this you can see is an example of Gaucher cell involving the spleen. You can see large pale cells, and Gaucher cells, another thing is you will find the tissue crumple appearance in blood, bone marrow and all. But here you can see large pale cells with accumulated storage product disorder because there is lack of glucose cerebroside enzyme. Pale spleen, large accumulation. Yeah. Fine. Next we have yellow brown granular pigments seen in hepatocyte. It is a lipofuscin. Wherever you see yellow brown granular pigments, it's wear and tear tissue. Yeah? Wear and tear tissue, and it is seen also in heart and liver, particularly in heart and liver. But there is no consequence and is representative of result of autophagocytosis. Okay. Lipochrome which is present will not be deleted. Fine. This is an example of brown caustic granular material in macrophages in alveolus. It is a hemostatin. Yeah? It is due to breakdown of aldehydes and the release of heme in the iron in heme. The macrophages cleans up this debris and is usually recycled. Then you have a Persian blue staining of the liver to demonstrate large amount of hemostatin present within the cytoplasm. Persian blue can detect hemostatin. Yeah? Hepatocyte Kupffer cells. Ordinarily, only a few amount of hemostatin will be present in macrophages in liver and Kupffer cell as a part of iron recycling. Yeah? But very much excess is indicative of hemocytosis. Then you have renal tubules in which there is a large amount of hemostatin as demonstrated by Persian blue stain, and the patient here had chronic hematuria. If you have a lot of bleeding from this thing, renal tubules, chronic hematuria, hemostatin will be lining the walls of the renal tubules. Yeah? Then you have sclera, which is yellowish because it is having the predispositions for bilirubin due to yellow fiber. Which laboratory test is most likely present? Laboratory test finding is no rare. Hyperbilirubinemia may be jaundice. It has normally white sclera is okay, fine. May be unconjugated bilirubin, serum bilirubin. Fine, total serum bilirubin. No, fine. Conjugated or unconjugated. Fine. But more than serum bilirubin more than 5 gram per deciliter, unconjugated more than 5 is usually indicative of hemolysis. Yeah? Then you have yellow green globular material which is seen in small bile ducts in the liver. This is bilirubin pigment. Okay, it is a case of hepatic cholestasis. There is stasis of bile and there is obstruction to the flow of bile which can cause this appearance. Patient will be showing jaundice in this case. Okay, yellow green globular material. Next we have increased amount of circulating bilirubin causing physical examination of icterus, which is seen in the yellowish hue of the skin. The easiest place to see is the sclera of the eye because of excessive amount of yellow fibers. Yeah? Black streaks seen in between lobules beneath the pleural surface due to accumulation of anthracotic pigment. This is anthracosis of lung, which is basically what you say. Workplace injury associated. So coal and all those carbonaceous material will be breathed in, and the patient will be having the smoking also will be having more of this pigment. But basically the coal and all those carbonaceous material, yeah? If you breathe it will be accumulated here. Then you have anthracoinic pigment in macrophages in hilar lymph node. Anthracosis is nothing more than accumulation of carbon pigment from dirty air. Smokers have most pronounced, and but it causes no major organ dysfunction. Okay, but cirrhosis is more dangerous, I would say. Dystrophic calcification. There's also a condition in co-worker, which is I think we'll get to it. Dystrophic calcification is a type is present in the wall of the stomach. You can see in here, and it is the fallus of it is artery with calcification is seen. Actually, give me 1 second. This is dystrophic calcification in the wall of the stomach, and the fallus there is an artery with calcification in the wall, and there is also irregular bluish purple deposits of calcium in this semi-mucosa here. It's more dystrophic calcification more likely to occur in damaged tissue. Then finally we have metastatic calcification in the lung of a patient with very high serum calcium level, hypercalcemia. You can see faint reddish all over here. Okay. And with that we finish the cell injury. After this I'll take a little bit of a break and we can do forensic pathology. Forensic pathology is very simple, mostly on drug use, abuse, environmental accidents, but not that much pathology can be seen. This will be done very fast. Immunopathology, infection, inflammation, all of those will take time. Neoplasm is one of the major difficult topic because a lot of different organs are there. This will take a lot of time, but I will get back to you guys. I have to do a small little work and I will come back and continue the broadcast here. Okay, so let's continue with forensic pathology. And, yeah. So first we have blunt injury and physical trauma. First we have pneumopericardium. This is a very much like blood present in the pericardium is demonstrated as dark blood in the pericardial sac, which is open at top of C. Penetrating injury or massive blunt force to the chest is usually the causes, often from steering wheel, and there is rupture of myocardium and or the coronary arteries with leading into the intraperitoneal cavity. The extensive collection is leading to cardiac tamponade, which is a emergency, and pericardiocentesis with a tube can be a diagnostic procedure. Because also can detect it. But sometimes sudden deceleration injury in a vehicular accident will produce a tear in the aorta. This leads to this happens if this usually happens distal to the great vessels. If one's parachute fails, like okay. Another is parachute injury, and there is injury. Tear is usually present in the root of the aorta. There's sudden loss of blood into the chest and subsequent shock. Next, we have this is laceration of the liver. Laceration of the liver and into this capsular substance of the liver. Damage to the abdominal organs with laceration, crust injuries, and rupture can lead to bleeding into the peritoneal cavity. This is called as what do you call hemoperitoneum. Yeah. Peritoneal lavage can detect such types of bleeding. Next we have blunt force injury to the head of the skull. This is the sagittal suture, coronal suture, sagittal suture, and base of the skull maybe. This is very blunt trauma to the head of the skull will often lead to fractures. The orbital plate of the base of the skull will demonstrate multiple fracture, as shown in the arrow mark here. It is seen in a old patient who has fallen backwards, and the force of the blow was transmitted forward. This is also called as contra-coup injury. This characteristically a lot of skull injuries are contra-coup injury. Basically, there is a direction of injury in one direction and the force of the injury in another direction. Then this is an image of which is showing direct traumatic blow to the head, which is producing a sketch near the vertex. There is bleeding over here. That's it. Trauma to the skull. Not very much specific. Blood trauma to the head suggested by scarp contusions can be seen here. All these small bleeding can be seen. Those are scarp contusions, which is subdural connection of blood. Glia is one of the most connective tissue heavy disorder. There's a lot of connective tissue, and because of which it is very much indicative of injury to the skull. Okay, let's go next. This is a small contusion in the arm. Blunt force injury, small ruptured. This thing, what do you say? Small ruptured vessels in the dermis and underlying soft tissue, leading to extravasation of the blood. Initially, it is red to blue. Over time, it becomes broken down using bilirubin heme, which is processed by macrophages. So here it is a yellowish brown hue, which is usually seen after week. Initially it will be red to blue, then it becomes green, then it becomes yellow, then it becomes brown, then it becomes clear. Over a course of 2 weeks it will be gone. Abrasions are scraping injury to the skin surface, usually irregular abrasion. It is seen on the knee over here. It may be indicating what type of the surface had actually caused the abrasion. Foreign material may be implanted, in which case you have to remove it. Abrasion seen here on the skin. This is another abrasion in the leg of the skin. It is irregular superficial tearing of epidermis. Patterned abrasion is seen over here, scraping along the rusty surface of a metal tank during a fall. During a fall, there is a metal something over there, and rough surface of a metal tank, and it is indicating the type of nature of surface and direction of force. It is going this way. The person is going this way. You can see. Then we have the superficial laceration of the forehead. Note the skin is very surface is broken. Some types of skin is also present over here. Irregularly toned skin tags are similar because it's irregularly toned. Yeah, very easy to treat all these. Just put some sutures. Yeah. Then you have lacerations made on the surface. Skin, the cut surface is irregularly pressing down, and underlying tissue. The incision is right. Okay, fine. These are all small lacerations. Yeah. Due to contact with irregular object, it is usually deeper than abrasion and more regular than incised wound, where it's not like irregular. These are all just confusions. Lacerations. This is an incised wound on the skin of the hand. Due to sharp surface, lacerations are produced in more irregular object, but incised wound is more clean objects, and lacerations is usually irregular broken areas. Then fat embolism. These are cleared round holes. It is characteristic in fat embolism. This is usually a consequence of trauma from bony fractures. Okay. Subsolidation from orthopedic procedures also will lead to fat globulin. Red oil logo stains the fat globulins within the pulmonary arteries, and globulins red orange appearance. Cumulative effect through the lung is through a similar large emboli, but onset of dyspnea is usually 2 to 3 days following initiating events such as blunt trauma with bone fractures. Yeah. Then you have capillary loops of glomerulus containing fat globulins in a patient with fat embolism syndrome. Then you have fat embolism leading to brain purpura is shown here with petechial hemorrhages produced by fat emboli on the brain, particularly in the white matter. Subsequently, it can be edema with herniation. But subsequently, to this, there is brain edema with herniation. Brain edema with herniation is seen after this petechial hemorrhage with fat embolism syndrome. Okay. And cerebral edema and hernia may follow over patient with a history of trauma develop fat embolism, but it's difficult to predict which patient will. And protein metabolism include hypoxemia, mental challenge status, petechy, fever, tachycardia, and thrombocytopenia. This is red eye showing peripheral cerebral artery branch with lipids, globules of lipid, fat embolism syndrome. Usually is reported treatment. This is a shaken baby syndrome. It's a door, but violent shaking of an injury will lead to neurological injuries, and the head is proportionally large as compared to the infant body. Neck musculature is not very well developed. That's why it's more prone for shaken baby syndrome. Yeah. Extensive intracranial, often subdural and retinal hemorrhages, which can be fatal. Okay, do not shake away. Most commonly in young male left alone with baby. With the baby loses self-control because of the baby's crying and shakes the infant. Such usually leads to small infected on a small scale as well. Retinal hemorrhages can be seen. Yeah, a little bit of hemorrhage over here. This lead to conviction of the baby. This is a very sad state. Okay. Next, we have process violent shaking or rotational injury as in passenger ejected from a moving vehicle can lead to stretching of the axons in the vertebral brain matter. If there is axon stretching, then it can lead to a syndrome called as diffuse axonal injury. This is one of the most common cause of death. Not like how do I explain this? It's like most of the trauma cases which you find because of this random thing, you usually find people die. Yeah? CT imaging will show subtle petechial hemorrhages at the interface of grey and white matter, and in cases of retraction balls will be seen if silver staining of the white matter is done. Yeah? This is an example of mechanical asphyxia, including strangulation, which can be marked by petechial hemorrhages on the conjunctiva. However, this is not very specific. A lot of cases will have injuries, traumas, will also have these. Ligature marks on the neck, hyoid bone, or soft tissue larynx may indicate the type of injury. And then we have cerebral scan showing no apparent perfusion to the cerebral hemisphere. This is an example of cerebral scan. This can occur following injuries, traumatic bone, toxic, metabolic, ischemic. There may be also residual brainstem function. Patient can be kept alive with mechanical intubation with what do you call this? Mechanical ventilation through feeding tube, but there is brain death. Yeah, brain death is usually indicated by cerebral scans. Usually a lot of factors in that. Okay. Then we have, this is the base of the skull. There is few grossly visible reaches of drowning. This looks like this is the yeah, fine. Frothy fluid may exude from nose and mouth. Yeah, so you can see that in the bilateral preterist ridge of temporal bone hemorrhages will be occurred due to drowning. It is respiratory impairment from submersion of liquid in the lungs, and there is submersion of entire body or just the pharynx. But a lot of cases are there. There may be dry drowning. There may be spasm of larynx due to water entering. A lot of cases are there. It can be due to vagal initial this thing. There may be fresh water and deep water drowning. But this temporal bone hemorrhages may be associated with drowning. Yeah. Frothy fluid from mouth and neck and mouth and nose is very much indicative of drowning. Drowning may also produce extensive findings. In fact, 10 to 15% of the cases, intense laryngospasm will be present with to prevent water from entering the lungs. In this case, soil is drowned in fresh water in canal, and most of the plant material in the water is aspirated into the bronchus. That's why I think you find lymphocytic, neutrophilic infiltration and all. Yeah. Lymphocytes, neutrophils and all that. Leukocytes are. Seeds occur between 1 month to 1 year of age. Mainly do not trace them backwards. Yeah. It may be unknown cause, but it is related to delayed neurological developments and varies from 0.5 to 5 per thousand live birth. Seeds can be decreased if patient baby doesn't sleep prone. Baby should always sleep on their back, not even left little bit is right. Fine. Then we have image showing cherry red or brown brightening lucidity on hand. This is carbon monoxide poisoning. It is asphyxia. Yeah. Even small atmospheric concentration is dangerous because carbon monoxide binds 200 times more avidly to oxygen, and drowsiness, headache, and it can occur even with 10 to 20%. 20 to 30% is more than 20 to 30% is almost always fatal. Yeah. Lucidity can be a result of cyanide poisoning. This similar lucidity can be seen in cyanide poisoning or monofluoroxide acetate poisoning. So how much have we done? I will continue in another 15 minutes. Time being, I will stop.